Many moms and dads are worried about reflux, and reflux is something that challenges us. But reflux happens to everybody. We have a kind of a joke in the neonatal world that spit happens, and it does. Every baby is going to reflux a little bit, and that's because the muscle that connects the esophagus, where you swallow food, to your stomach is very loose, and that's okay. Sometimes when babies cry, their stomach fills up with air, and if they want to have a burp, the air comes up, and so does a little bit of the food. Many people are concerned that premature babies are going to have even more reflux. Not every premature baby is going to have reflux that you will see, but every premature baby is going to have a small degree of reflux that may or may not come back up their esophagus. In general, most babies outgrow the reflux, and it's challenging for mom, and it's frustrating, and you're doing a lot of wash, but in fact, it doesn't need intervention. If your baby is not gaining adequate weight, or your provider is concerned about your baby's cry, or concerned that that the vomit is actually what we call projectile, so it's sort of missing, not dribbling down you, but sort of going out and very forceful, that is a little bit more concerning, and that's not just clinical reflux. That might tell us that there's an underlying problem for the baby. So if the baby is throwing up and the color is green, if the baby is throwing up in a very forceful manner and your milk is going onto the floor and not even touching you or the baby, that's called projectile, and that's a little bit more concerning. So if you think that your baby is doing these things, you certainly can talk to your provider. But just know that reflux is normal. All babies do it to a certain extent, some more than others, and your baby will outgrow the reflux.